Hi, everybody. It's great to be with all of you this afternoon. I have the special privilege of working with Vivek Murthy, our current United States Surgeon General, on the National Academy of Medicine's Action Collaborative on clinician well-being and resilience. The National Academy of Medicine started that Action Collaborative in 2017. There's about 60 of us leaders throughout the country that were appointed to work on that Action Collaborative. And Vivek, our Surgeon General, is one of the co-chairs. Last month, Vivek issued a Surgeon General's advisory on clinician burnout. And I want to just highlight the key recommendations and points from that advisory, along with what we can further do about this critical situation. But before I begin, I just want to give each and every one of you a dose of vitamin G for gratitude. It's been a character-building 2 years with the pandemic, and I deeply appreciate all that you have done and continue to do every day. So you can access this full report at the website that is listed on this particular slide. And we will share a PDF of this presentation after the talk. Well, we all know burnout has many negative consequences for clinicians, mental health struggles, substance use disorder, depression, suicide, anxiety, insomnia, heart disease, and diabetes. We also know from a big body of research, if clinicians are not physically and mentally well, healthcare quality and safety is adversely affected. When well-meaning clinicians aren't well, there are more medical errors. And sadly, about 250,000 people across the United States die from preventable medical errors every year. Burnout also results in workforce shortages. You know, we refer to the Great Resignation, but it is really impacting our healthcare workforce. And for our community, burnout leads to reduced population health outcomes, an increase in health disparities, and an erosion of trust. Well, there's a lot of factors that contribute to burnout in clinicians: societal and cultural factors, healthcare system factors, and we know we've got to fix system issues that are at the root cause of burnout. We can have all the best evidence-based wellness programming for our folks. But if there are system issues like too many bureaucratic tasks, too long of shifts, understaffing, we can give all the wellness programs we want, but until we fix the system issues, it's not likely to improve. Organizational factors. I work so hard with our top leaders throughout our system to make sure we all are supporting wellness, that we walk the talk. And then it's critical to start protective factors with our learners from the month that they walk into our health professional programs. We also know there are certain groups of healthcare clinicians who have been disproportionately impacted. Health workers of color, immigrant health workers, females, low-wage workers, health workers in our rural and tribal communities. So in the VEX advisory, he clearly outlines what healthcare organizations can do. And the first point he makes, which we have such a big emphasis on here at Ohio State, is to transform our culture. Culture eats strategy for breakfast, lunch, and dinner. But culture shifts take time. They take a multi-component approach. Our Buckeye Wellness innovators, they are a force in the grassroots, helping to transform culture. But managers, supervisors, and top leaders all have to contribute to shift in culture. So we make healthy choices easy for people to make. We vent mental health issues to recognize them are a strength. They're not a weakness. We have wonderful supports for people to get mental health help. Last year, we did a whole university med center campaign on vitamin G, the practice of giving and taking a dose of vitamin G every day. We have a lot of research that shows, even more than money, people appreciate being valued. And I just want to encourage all of us to think about getting up in the morning, counting our blessings, and very importantly, giving that dose of vitamin G to somebody every day. It's important, like our institution has made a commitment to the health and safety of our clinicians. We need to continue to revise policies to ensure our people are not deterred from seeking appropriate care. We have a very action-oriented plan to address bias, racism, and discrimination. And then we deliberately invest in health and wellness from a prevention standpoint. And that is such an important strategy. So in this U.S. Surgeon General's advisory, the VEC also outlines federal, state, and local tribal governments, what they can do. He talks about investing in evidence-based practices. You know, we used to joke about the 17-year time gap. That came from a study, a landmark paper that was published in 2000 by Bayless and Boren. So for 2 decades, we've said, oh, it only takes 17 years to translate what we know works from research to the real world clinical settings. A new study came out last year that actually showed in 2 decades, we have only moved the needle by 2 years. It now takes 15 years to translate what we know works into practice. At that rate, if we don't accelerate things more rapidly, it's going to take 150 more years for us to generate research, know its best practice, and to get it implemented. Well, federal and state governments also need to increase access to quality, confidential mental health and substance use disorder care, along with addressing punitive policies. Certain licensing boards still give you a ding if you admit to having been treated for a mental health condition in the past few years. That has got to change. So, other insurer actions. We've got to support both quality and quantity of time spent with patients. And it's critical we look at where can we reduce bureaucratic tasks, administrative burdens. That's critical. And we need to increase transparency for healthcare providers to make better health decisions. In the VEC's Surgeon General's advisory, he also gives recommendations for what healthcare technology companies can do. We've got to strengthen integration of data across our different platforms and design platforms with interoperability right at the onset. And lastly, in his advisory, he strongly talks about needed recommendations for academic programs. We at Ohio State, we do prioritize, assess, and support learner well-being. About 7 years ago, we started a wellness onboarding program for all our health sciences students. What we have learned from that program is students entering our health sciences colleges on average 30 to 40% meet the cutoff for depression and anxiety. 10% express suicidal ideation on their way in. If we wouldn't do this wellness onboarding survey, we might see more suicides because we are able to get help to those students. We cannot treat wellness as a nicety for our students or our employees. It truly is a necessity. Then the Surgeon General outlines what can we as clinicians do. For one, recognize the signs of burnout, depression, distress. Say to ourselves, it's not a weakness if we are suffering from those symptoms. It's a strength to recognize when we are affected and to go get help. If we see colleagues that are struggling, I always tell people, ask 4 powerful words. Are you okay today? Let us get back to prioritizing just a tiny bit of self-care every day, because we can't continue to pour from empty cups. We've got to take a little time, just even 5 or 10 minutes every day, to do something that brings us joy or improves our well-being. We, though, must shift the paradigm to a we issue. We must together continue to work at building the best wellness culture we can have here at Ohio State. Even before the pandemic, the National Academy of Medicine said, we do have to do something urgently about clinician burnout, depression, and suicide. So our Action Collaborative put together this fabulous clearinghouse of evidence-based resources and tactics. If you have not seen this website yet, I really encourage you to check it out. I just presented our wellness model at a HRSA council meeting. We take an evidence-based, multi-component approach with a focus on improving outcomes of all of our Buckeye family. We target our interventions down in the grassroots with our Buckeye Wellness Innovator Program. We target faculty, supervisors, and managers with terrific workshops. We target our top leaders, and we try our best to fix system issues that we know cause burnout. We do it all within a culture of well-being. We are so diligent about measuring outcomes, because if we don't know our outcomes, we don't know where to target our interventions to improve those particular outcomes. We have a fabulous one university approach to health and well-being. We have a one university health and wellness council that has leaders from all of these areas that sit together once a month. We look at data together. We look at best practices. We come up with new innovations, but we are aligned, which is really important if we're going to have a great wellness culture. We use the sociological model to improve outcomes. So we target evidence-based interventions to the individual, the family, the workplace culture, and policy. We are a university, again, who has one of the strongest evidence-based quality improvement approaches to wellness that I have seen throughout this country. Our tactics that have worked include all of these. We've got a very bold, ambitious strategic plan. We monitor outcomes regularly. We focus on prevention, fixing system issues, building resilience and coping strategies in our people. Us Buckeyes love friendly competition, so we do a lot of that. And we also try to make wellness easily, readily accessible and fun. So I'm going to finish my talk today by asking you to take a hard look at this slide. I want you to be honest with yourself. This is a one-item valid burnout scale. In wherever and how you define burnout, what is your level of burnout right now? Coming out of the pandemic, even if you're not burned out, a lot of people are fatigued, their energy's a little low, they're not as motivated as they used to be. If you fall into that category, you may be languishing. So if you're fortunate enough to answer this burnout question with response 1, that's great. I would say you do probably prioritize your self-care. You're aligned with your dreams and your passions. But I encourage you, if you fall into the 3, 4, or 5 response set, it's time to get some help. And again, that's not a weakness. It is a strength. The red flag warning for depression, anxiety, and burnout. If it's starting to interfere with your concentration or your functioning, it's time to get help. If you see somebody struggling, just stop and ask them, are you okay today? Sometimes that's all it takes for somebody to open up and for you to encourage them to seek a little help. So please, even if it's a 5 to 10 recovery break minutes, take that a couple of times a day. Be kind to yourself. We have such high expectations for ourselves. Now more than ever, we've got to show ourselves some self-compassion. You don't have to be born with resiliency. You can develop that as you go throughout life. We have so many programs to help you with that. And don't feel guilty about saying no. You're not superhuman. Don't be bashful about or embarrassed about asking for help. We have, again, so many resources. Will at Your Plan for Health has wonderful self-help programs, personal health coaching, group health coaching, mindfulness. We, again, as you'll see on these next slides, we have so many resources to help you build your resiliency, get help if you need it, prevent mental and physical health problems. And these are 12 wonderful tips, ways to renew and find joy in everyday life. We've got to get back to dreaming again. A lot of people have lost hope and lost dreams during the pandemic. If we get up every day and we're aligned with our purpose, our dreams, and our passions, we'll be excited to get engaged into our days. I want to give a shout out for our Buckeyes Pause program. I see when I make rounds in our hospitals, the stress reliever these dogs are for our staff. Again, we have so many resources. Familiarize yourself with all of the resources that I have listed for you on these slides. As leaders, we want you to take time during your days again to engage in a little bit of self-care. Lastly, I want to point out our third biennial national summit on promoting well-being and resilience is coming up September 28th to the 30th. It is sponsored by all of our health sciences colleges, social work, and our medical center. We've got a dynamite lineup of speakers and content. So with that, again, thank you for all you do every single day. Take good self-care.
Does anyone have any questions they'd like to ask Bern before we release?
If not, I wish all of you a great, well afternoon. Don't ever hesitate to reach out to me and any member of our wellness team. We are here to support you in your efforts to be well. Thank you.